Greetings! I am Brad Hessel, and I am running for North Carolina State Senate in District 18. So, healthcare costs in the USA are more than anywhere else in the world, but the quality we get for that price is nowhere near top of the line overall. I would suggest there are a number of basic flaws with our current system. For one thing, no one else on the planet ties healthcare to employment. And the fact that we do is an historical accident, not a conscious policy decision. The result: huge disparities in health service availability that are costly to ameliorate. In fact, the whole idea of insurance for most healthcare costs is silly. It's like buying food insurance to cover the risk that you may get hungry. Sure, it makes sense to buy catastrophic insurance to protect yourself against the risk of a major and prohibitively costly health crisis. But no one buys auto insurance to cover the cost of gasoline or oil or new tires. We should all just pay for routine healthcare costs out of pocket and completely avoid the time, energy, and money we patients and our doctors are wasting on processing those claims through insurance companies. Which brings up another flaw. The relentless expansion of the health insurance companies into every facet of our care has broken the feedback mechanism that automatically and elegantly controls costs in every other aspect of our lives. It masks the price of care. Unless there's a screw up, and I get sent for a tested procedure or prescribed a drug that's not covered by my plan, I have no earthly idea what these things cost. And in most cases, neither does my doctor. It's not that price is no object and the doctors and patients are deliberately taking advantage of the system to select Cadillac care options. Rather, they just don't consider costs at all, because it's not a relevant factor so long as my insurance pays for it. And if you don't believe that drug companies and hospitals take advantage of this dynamic to push expensive treatment modalities that would probably not be cost effective in a free market environment, well, would you be interested in buying an ownership share of the Brooklyn Bridge? And speaking of drug companies, what about the cozy arrangement they've crafted with government to soak US customers for premium prices for their products, while everyone else in the world pays what the drugs are worth on the free market? But we're not allowed to buy those drugs at a fair price from a vendor in Canada. Of course, all these flaws drive up the overall cost of healthcare without appreciably improving quality. And to be honest, there's not a whole lot that can be done about some of them at the state level. You need to write your congressman and the president. I have. Still, there are some things that North Carolina can do to promote high-quality, accessible, affordable healthcare based on choice. 1. Transition the current Medicaid direct payment model to a state-funded health savings account, giving people more flexibility in defining the healthcare options that best serve their individual circumstances. 2. Eliminate anti-competitive and protectionist certificate of need laws that hamper the growth and affordability of healthcare services, especially in rural and disadvantaged urban communities. 3. Address the state licensing roadblocks preventing innovative healthcare delivery options such as direct primary care, telemedicine, and out-of-state licensed doctors providing charitable care. Elect me to the North Carolina General Assembly, and I will be asking why a dental hygienist can't clean teeth except in a dentist's office, why a midwife has to have a relationship with a hospital to serve any patients, why a charitable organization that wants to offer free dental care in indigent rural areas can't operate in North Carolina because their dentists are from Tennessee, and other pertinent questions. I'm Brad Hessel, running for the North Carolina Senate in District 18, and I approve this message.